Hi, thanks for joining us for this video. I'm here to talk with Dr. Melanie Rutkowski, who works at UVA. We're going to be chatting about the microbiome and what that means for breast cancer. So, Dr. Rutkowski, would you mind introducing yourself and mentioning a little bit about what you do?
Yeah, absolutely. And so first off, thank you for having me. I'm thrilled to share some of what we're doing and also just what we know about the microbiome and how it relates to breast cancer. And so our lab is very much interested in understanding essentially why some women who are diagnosed with breast cancer develop poor outcomes, whereas other women do not, despite being treated, exactly the same, being diagnosed with the same disease. And a lot of what our work is really focused on is understanding how differences that are not non-genetic differences are affecting some of these differences in outcome. And mainly it's related to the host commensal microbiome and their interactions with immune cells and how that affects breast cancer growth, metastasis, and therapy response.
So, as a little bit of a beginning, what exactly is the microbiome or a microbiome?
Mm-hmm. The microbiome is, if you think about germs, they're a collection of germs, but they are very good germs that inhabit all surfaces of our body that have exposure to the outside. And so think of the skin, our respiratory tracts, our gut, where's the largest population of these microorganisms, and then our urogenital tract. And these microorganisms, they consist of mainly bacteria, which is what we know the most about, but also viruses, different fungi, and even really primitive type of bacteria, the ones that live in really kind of hostile or extreme conditions called archaea. And collectively, these microorganisms comprise of the microbiome. And what they do and how they interact with the cells at all of these surfaces, but also the metabolites and their byproducts of respiration and metabolism can affect us in all sorts of ways, including mood and behavior. I'm sure a lot of people have heard of this like gut-brain link, which is a very cool area of study. They can affect our appetite, our metabolism, and really they serve as like a first line of defense against invading pathogens. And where we're really interested in it is that they can have a profound effect on our immune system, which, in the context of cancer is a really important aspect of, not only preventing or recognizing malignant cells or tumor cells, but also the way that the tumors are allowed to grow or leave that tissue to metastasize to other sites. And so they can have a profound influence on all sorts of aspects of cancer in general.
Yeah, so in recent years too, I've heard a little bit about that the breast actually has a microbiome. Can you talk a little bit about that?
Yeah, absolutely. And so the breast is, it's another mucosal site. And it's been shown that, there are, even though it's not as densely populated as, say, the gut would be, there are microorganisms that inhabit that site. And what research has really started to become interested in, especially related to breast cancer, is, there's more and more evidence that it's not just genetics that affects breast cancer risk, but also outcome. It's, these host intrinsic factors are, things that are happening inside and on our bodies, or things that we're exposed to that also affect the risk. And people have started looking at the microorganisms that reside within the breast tissue, because these microorganisms can shape the structure of the breast tissue. They can influence the cells that reside there. And if they're comprised of a really unhealthy, or I'll say toxic population, there's theories, and this is more well known in the aspect of colorectal cancer, that some bacteria can actually produce toxins that can cause mutations in our normal cells that may lead to cancer. And so there's a lot of active interest in that. And what they found by looking at the breast microbiome of women that have been diagnosed with breast cancer, and either comparing those microbiome to either their normal tissue or microbiomes of women that are not affected by breast cancer, is that their microbiome is distinct in relation to the cancer. And so the cancer is likely changing, that microbial composition for reasons unknown. And it looks unhealthy or a little bit different compared to what's present within a normal. And so how, those changes are really influencing breast cancer outcome is an area of very active research.
Yeah, that just brought to mind, there's the connection between breastfeeding for an extended period of time and decreased risk of breast cancer. So just, hearing you speak, thinking about, well, the production of milk, things are actually being produced and coming through the ductal system. So I wonder if that's part of the research, I'm guessing.
Oh yeah, absolutely. There's interest, of course, with, identifying things such as the breast cancer, the extended breastfeeding, and an extended breastfeeding, and how that affects the composition. But also there's some really cool research that is looking, and they're using non-human primates to do some of this work. And what they have found is that if you eat foods, like they compared the gut and the breast tissue microenvironment of these non-human primates that were fed either a Mediterranean diet, and so a more healthy one, versus a Western diet. And they found that not only were the gut microbiomes changing, but also the breast tissue microbiome. And so, not only, for example, the breastfeeding, but I imagine just any sort of exposure that is changing our guts, and the antibiotics and all of these other things that we're exposed to can all have an influence on that composition. And it sort of gives rise to this idea that, even though there are these separate tissues, collectively what they're making and what they're producing, if you look at like what the gut microbes are producing and their metabolites versus what the breast microbiome is producing and their metabolites, they actually look quite similar. And so it almost makes you think they're connected somehow, but how, how that connection is established, and how that might affect breast cancer risk or outcomes. There is so much research into that now. Absolutely. Yeah.
Yeah, so you talked a little bit about some theories on how the microbiome can influence cancer development. And so I'm just curious, like kind of packaging that. So it sounds like maybe some of these bacteria are potentially creating toxins that has an effect on the environment, but also I imagine there might be an absence of good bacteria that would lead to cancer development.
Yes. No, and you've more or less kind of encapsulated the field really beautifully, in that there's always this balance of good bacteria and bad bacteria, in that sometimes when these bacteria that are associated with health, and they're associated with better metabolism or less inflammation, if they're absent, the bacteria that, they're still there, but now they have a space to grow out if these other bacteria are missing. And so then, they can change in numbers, but they can also change in what they're doing, and so maybe their metabolism changes in response to this new population, and really they're only doing it to try to survive and cohabit that space. And they could also be changing in response to maybe the tissue is becoming inflamed or the person's being exposed to antibiotics. And so there's not a lot known, because most studies to date have really just, they look and they characterize what's there versus in a diseased tissue. So for example, in a breast tissue that has cancer versus what's in a tissue that looks or appears normal. And so it's all very much correlative, and it's like to find a cause and effect relationship has been really challenging, especially because you can't do these experiments in humans, and so a very recent paper actually that came out of Johns Hopkins, I believe, what they did was they looked at the mammary tissues of women that had breast cancer versus those that didn't, and they identified this toxin-producing bacteria that is often associated with colorectal cancer. And that was a really surprising finding in women with breast cancer. And what they found is that when they colonized mice with that bacteria, and so this bacteria is one of those that you consider opportunistic. And so they only come out when there's this space that is available. And they can become kind of pathogenic in response to that. And so they found that, this bacteria that was producing a toxin not only made the tumors in the mice grow faster, and they colonized both the tissue and the gut. And so it seemed to have this dual effect, but it also caused the tumors to metastasize more readily. And so that's one of the that I know of, the only papers that I know of that have actually shown mechanistically within that breast tissue, a cause and effect with the presence of a single bacteria. I speculate that it's probably even more complicated than that. And I think that that's where the value of the, use in the biomedical research field and using these animal models, we can try to, understand a little bit better how the presence or absence of certain bacteria are really affecting kind of the tissue health, and also the ability of the tumor to grow and metastasize.
Yeah, let's zoom in, I guess, a little bit more and talk more specifically about certain breast cancer treatments and how that has an effect on the microbiome, and maybe a little bit of vice versa. So chemotherapy, I think that's a major treatment for breast cancer, and we know it can have effect on the digestive system, but what kind of does that look like when it comes to the microbiome?
Chemotherapy can drastically change like the gut microbiome health for sure. And, it's more or less unavoidable because it causes all of that tissue damage within the gastrointestinal tract. And so you get, tremendous gut leakage, and you get, you lose, maybe more health associated commensals associated with that. And often, when you're undergoing chemotherapy, sometimes you have to have antibiotics to ward off infections as well, which, again, it's unavoidable. And so what people are really trying to understand is, can there be synergy with certain chemotherapies to actually have a health associated effect? And so, to try to take advantage of this, drastic changing of the gut microbial ecosystem, which is unavoidable, but to leverage that and figure out how we can use that to our benefit. And so there's been a group, for example, in France that have done a lot of work where they've shown, certain chemotherapies actually require this gut leakage to elicit a positive effect on the immune system. And so it actually boosts the immune system's ability to attack the tumors because of that leakage of the commensal microorganisms. And so, understanding that a little bit more across, for example, chemotherapies that are traditionally used for breast cancer, is another area where people are really trying to understand, not only how the chemotherapies affect the gut microbiome, but also how the gut microbiome itself and the composition and the ability of these commensal microorganisms to metabolize certain drugs, how they actually contribute to the efficacy and the ability of these chemotherapies to actually work. And so that's another area of research, is really understanding how when you deliver these chemotherapies, how that composition can affect the activity of the drug.
Mm-hmm. And so, let's think about radiation treatment.
Mm-hmm.
So that's not a systemic treatment, but obviously if it's focused on the breast, there's a chance it'll affect the microbiome in the area. So what does that look like?
And that is kind of a more emerging field right now. And there's not a lot that has been published in terms of like the local irradiation and its effect on the breast tissue. But what people have found is that indeed, again, it is changing the microbiome, and it's changing it not only on the skin, but also within the tissue itself. For example, the radiation on the skin, you get all of these skin lesions. And so clearly there's a lot of inflammation that could be happening as a consequence of the irradiation. And that in and of itself will change the composition of the microbiome. And I mean, the good thing about, all of these treatments is that, over time, your microbial ecosystem, pending that you're not drastically changing environments, for example, where you live or how you're eating, it will eventually go back to being how it used to be, like pre-treatment. And so one thing that we can think about in order to try to keep our microbiome as healthy as possible during these therapies is to really be conscientious about the foods that we're eating. For example, really trying, although patients when they're on chemotherapy do not have much of an appetite, but to try as best as they can to eat a diet that's high in fiber, or with, prebiotic foods such as honey or oatmeal or green apples and bananas, things that really provide that boost, which would be in the form of fiber, which is kind of a food for the good bacteria within our guts and systemically, and really try to maintain the health despite, all of these therapies that, unfortunately are a little bit unavoidable in terms of their efficacy. And so it's a very new area of research in terms of the radiation. And I suspect, similar to what they found with, chemotherapies and immune therapies, is that, researchers are likely to identify a certain composition of bacteria that reside, for example, within the breast tissue that may actually enhance the benefit of those radiation therapies. And, how to, again, kind of take advantage of that and make so that we could give everybody that unique and therapeutically effective microbiome is another area of research. And so how do, we get your microbiome to look like my microbiome if my, tumor is responding better to the radiation therapy compared to yours? And so that's, an area where people are really trying to understand and take these discoveries, more into a clinical setting, whether it's, using probiotics or, developing food or, prebiotic-based therapies to really try to control that composition.
So this is somewhat tangential, but can you define the difference between a prebiotic and a probiotic?
Yes, absolutely. And so probiotics are typically either they're defined composition of typically bacteria, that are present. And so you have probiotic foods such as yogurt, and so it has this defined composition of bacteria inside. Or you can think of the kombucha tea, and they have these, these fermented foods basically, and they have these sort of defined consortia of commensals, or you can take the probiotics, which are essentially pill-based form. And so they're delivering of the bacteria to, as a supplement, and usually they're live bacteria, and they either do or do not kind of engraft, which means they'll like stay and, contribute to that population, or they may not, and they'll just deliver kind of a transient health benefit. And really it's not known because that area of research is not necessarily regulated very well. And so then you have your prebiotics, which are typically in food-based form, and that's really intended to kind of feed or enrich for the good bacteria. And so it's foods typically high in fiber or with a kind of a, therapeutic benefits, such as honey, that can, really help to enrich for the outgrowth of certain commensal microorganisms that, tend to have more health-related benefits.
Great, thanks for that.
Mm-hmm.
So after active treatment, many people are on hormonal treatments like tamoxifen or aromatase inhibitors, and that obviously has an effect on estrogen. So can you talk a little bit more about maybe the role of estrogen in the microbiome, or the lack thereof?
Yeah, absolutely. And this is a really, actually, historically, it's really interesting, because the discovery that there are actually bacteria that can metabolize estrogens are really what, helped to kind of transform the thinking of the field in terms of breast cancer research, and really what zeroed in researchers to the microbiome having a possible effect on, breast cancer risk and outcomes. And then, there were all of these epidemiological studies that found, and again, this area of research is actually still, I would say, quite controversial, finding either positive or negative associations with certain antibiotics and breast cancer risk. And so in terms of, now you're on either, the hormone therapy, there's been some studies that have found some interesting results. For example, if women are on hormone replacement therapy, for example, after they go into menopause, they find that the microbiome, because when you go into menopause, the microbiome actually changes. And so in the absence of those hormones, the microbiome, there's this reciprocal kind of change in the composition of the microbiome, which tends to associate with increased weight gain and a change in metabolism and metabolic health. And what they found is that women on hormone replacement therapies, actually their composition of the microbiome will shift back to their pre-menopausal state. And so these hormone therapies, they're again, and this is a very new area of research, but they're finding kind of similar things in that, and I've seen papers kind of on both ends of the spectrum, but generally it seems to have a beneficial effect, on the composition of the gut microbiome, is, these long-term kind of hormone therapies to, especially for those women that are having hormone receptor positive breast cancer, that they have a positive effect on the microbiome. I have seen some papers that have shown actually an opposite effect for, other hormone related cancers, but, again, these studies are typically associative in that, they're looking at the composition in humans and, just finding either a positive or a negative benefit there, but they haven't experimentally, demonstrated, okay, the gain of this commensal or the loss of this commensal are really what's driving either a breast cancer recurrence or, the emergence of another type of cancer. And so that's an area of active research interest, and one that we're actually really interested in pursuing ourselves to try to understand, this link or the relationship between the hormones and these therapies, and how the gut microbiome is responding to that, either good or bad.
Thank you. You talked a little bit about things that can be beneficial for people to do to protect their microbiome during cancer treatment. So we talked about fiber and maybe some fermented foods. Does that kind of act like, the thing that I can compare it to is when you're on antibiotics, it can be recommended to have a yogurt every day or take a probiotic to help restore that balance of good bacteria, since the antibiotic is going to kill everything. So sounds like prebiotics might be more the way to go for people going through cancer treatment.
Right, absolutely. I mean, I think, and again, this is sort of my opinion based upon, some of the work that we've done and studies that I've read about, is that it's, the major way, or the most beneficial way to affect the gut microbiome is food related, and so like the yogurts or the fermented foods or high fiber foods. Other ways that you can try to, change the gut microbiome for the better are, really trying as best as you can to reduce stress, because stress itself can negatively affect the gut microbiome. Whether it's, trying to do yoga or meditative exercises, exercise itself can have a positive effect as long as it's not too extreme. And it can be beneficial in terms of, therapy response, or even just recovery from having any type of cancer, really. To try to cut out smoking, tobacco use in general, and alcohol use. And then obviously really, even if you're eating a lot of fiber, but you're eating foods that are highly processed as well, or high in sugars, that can have a negative effect. So even just simply eliminating those foods and, trying to eat as many fresh fruits and vegetables as one can, is another way to try to tip the balance towards a more favorable gut microbiome.
And you mentioned go ahead.
I was going to say, when you're on all of these therapies and, if you develop an infection or some sort of adverse effect of the chemotherapy or the hormone therapy that requires the use of antibiotics, by all means, one should take those antibiotics. And then, try to offset the effects of the antibiotics, as you said, with, these more positive activities, or trying to change the diet so that it supports a more healthy microbiome.
Yeah, and you mentioned earlier that, in most cases, the microbiome will return to what it was before whatever disruptive event occurred. So I'm guessing we're seeing that in cancer survivors as well?
I don't know.
Researched.
Right. And so, some of these studies, especially where they're looking at the gut microbiome, are really, they're more short-term studies where they, very much look at the patients that are either being treated with a certain therapy before and after, but not necessarily, the long-term outcomes. And, this is where I believe that breast cancer will be really an important place to look, not only before, so for women that are at high risk, either genetically or if they have a family history of, and to monitor their microbiome, through the course of their, they're being surveyed by these high-risk clinics, but also then the women that have overcome the breast cancer and that they're survivors. And so looking at their microbiome. And so really where these data are very well established is in mice, more or less. And so, they'll treat mice with antibiotics or have some sort of perturbation. And they find that, over time, because really nothing else is changing, their microbiome will go back to where it was before. And so I think I predict that it's going to be a little bit more nuanced and people, but I would predict, all things being considered, that, as long as they're not changing their environment, or, if they're changing their eating habits, at least for the better, then maybe the microbiome can come back even stronger or better. But for the most part, if they don't make any changes over time, and so as long as they can achieve that similar health status that they had prior to their diagnosis, that it will turn back to how it was before.
So that's good to hear, and definitely sounds like more research is needed, but
yes,
signs are good.
Yeah.
So a couple things that I'm taking away from this conversation is one, that this is such an emerging area of research that there's some maybe not so great research out there, maybe not high quality, that can point people towards wrong direction. And there's also some really good research out there. So for patients and survivors to be really careful about what they take in and talk to their doctors about it. But also it shows that this is such an exciting, because we can see it on your face, an exciting field of research, and we need more people entering this field, because it seems like the more we learn, the more questions we have. So with that, is there anything that I didn't ask about that you would like to share, or is there any other big takeaway that you'd like the audience to come away with?
I would say, one of the biggest takeaways that I feel is important to share is that, the power of the gut microbiome in dictating, certain therapy responses. And, this is the most well exemplified for patients with melanoma, but people are thinking along these lines in relation to breast cancer as well, in terms of the individual's ability to respond to immune therapies. And what they've done now in melanoma is they've actually done fecal transplants to make someone who, their tumors are not responding to immune therapy. And with that fecal transplant from an individual, whose tumor was responsive, they're now able to have a tumor that's responsive. And so,
wow,
just switching the microbiome from someone who had maybe better outcomes, that could be a very powerful therapy, for the future. And that's an area that is probably the most achievable in terms of, all of the studies that are out there. And so really, to keep an eye towards these types of trials for patients that, maybe they're undergoing a therapy and, they find a trial that, is using fecal transplant to enhance some sort of therapeutic benefit. There could be a lot of potential benefit, for that, if it's very well defined that the microbiome is affecting whatever it is that they're looking at. But the most well studies is immune therapy. And so if they find immune therapy trials where people are looking for, breast cancer patients to try to enhance their tumor's response to various immune therapies, in my mind, it would be something, if I were to develop breast cancer, that I would very strongly consider and pursue myself. And so it's a very cool area of research, and there's so much potential in terms of how patients' cancer outcomes can be affected, and it's just, we're barely at the surface. And so I'm excited to see what happens in the next, 10, 15 years. And so, yes, we need more people in this field to answer all of these questions.
Well, Dr. Rutkowski, thank you so much for your time today. We really appreciate it. And we have a wonderful rest of your week.
All right. Thank you. It was my pleasure.
Bye.
Bye-bye.